as a part of our special initiative of hashtag Subspecialty Focus. Today we have invited Dr. Raj Patel. He is a consultant Uro-Oncologist and robotic surgeon at Zydus Cancer Hospital, Ahmedabad, Gujarat. So welcome Dr. Raj to Docthub studio, and we want to know what's your story, what's your experience, your academic journey, and currently not till date what you are working. So please give us your brief story on that.
Thank you very much for inviting me in Doctor talk. So if I talk about my journey, I did my MBBS and MS from Jamnagar and Rajkot Medical College, Gujarat. After that, I stayed as an assistant professor in general surgery department for 1.5 years, where I decided that I would like to do super specialty work. And after that, I started preparing for super specialty entrance exams, and then I got into DNB Urology in Apollo Main Hospital, Chennai, where I stayed for 3 years as a part of urology training between 2014 to 17. After finishing my urology training, I went back to my native place, that is Rajkot in Gujarat, where I joined BT Savani Kidney Hospital, which is a dedicated nephro-uro hospital, where I stayed for more than 2 years being consultant.
After that, urology
in a urology department. After that, I decided to go further in training of one subspecialty which I liked, which is Uro-Oncology and Robotic surgery. So I did a fellowship for 18 months in Uro-Oncology and Robotic surgery from Zydus Cancer Centre, Bangalore, India. After finishing my fellowship, I joined as a consultant in Urology Oncology and Robotic surgery at Zydus Cancer Centre, Ahmedabad, Gujarat. And currently my work profile is I mainly look after urological cancers at a cancer center. So I am involved in surgical management of prostate cancer, kidney, then urinary bladder cancer, penile cancer, testicular cancer, adrenal cancer, and I also look after few aspects of gynec-oncology, where I part of a team to work with a gynec-oncologist. So this is my work profile at this.
Okay. So now tell us about what were your thought process, and when you passed out as a DNB urology from the Apollo Main Hospital, Chennai. What was your thought process? Where and what to further?
Right.
As a being a specialist doctor, you have recently passed out your training period. So
Right. So when I finished my urology, I did my urology training in a center where there was already a fellowship option in robotic urological aspect. So, and the consultant or the fellowship director was, I like to work with him, and he also liked me as a trainee. So I asked him that I would like to join as a fellow in robotic surgery, but the golden advice that he gave me at that point of time was, you have to consolidate your basic urology skill set, and then you go into a subspecialty practice, because subspecialty or a fellowship is a place where you consolidate your surgical skill in one particular aspect. So you need to have a strong basic skills to start with. So that was the idea when I finished my urology. Then based on that advice, I had two goals initially. One is to have an independent decision as a clinician, and second is to perform surgeries in independent way. So these were the two goals when I completed my urology training and when I went into urology practice.
Okay. So why you switched to the Uro-Oncology practice after 2 years of urology in general?
Right. So as I said, that I had an inspiration and encouragement from my urology training, because the department where I got trained had 14 consultants, and they all had one area of interest and one area of expertise, which we would say is a subspecialty. Like two of my consultants used to be very good in oncology. Two of my consultants were very good in reconstruction. So I had that inspiration and encouragement to start with when I was in urology training. So 2 years I spent, as I said, in my basic surgical skill consolidation and independent decision making, and probably that was a good time to change, not change I would say, but to in continuity. I need to have some additional surgical skill set, and then I need to practice the same for rest of my career.
So while you were planning for subspecialty in urology, what was the initial dilemma, while choosing the urology subspecialty? Which one to choose? Why? And what's further career opportunities? You might have analyzed different things.
Yeah. So as a whole, I would say that after any specialty or super specialty, if you are focusing on subspecialty practice, it is a good move in general, I would say. When the situation for me to decide about the subspecialty, so I had a maximum exposure and training in Uro-Oncology and renal transplant surgery during my urology training. These were the two core area if I would like to highlight. So then I decided that I would like to go ahead in either of this thing. So when I have to decide between these two, Uro-Oncology was more close to my training and my interests and my likings, because you see patient for a long and you make a difference in their life by taking a good decision. It's not only about the surgery part. And second thing is transplant surgery. Even though it was really good for me, it is slightly, you have to be on emergency calls in transplant surgery. So Uro-Oncology was more appealing for me.
Close to your personality or close to your interest, and you wanted to work in that particular
so interest was there, and if we see the overall practice pattern, I decided to go into Uro-Oncology part.
So what challenges have you faced in this journey, the fellowship, choosing and completing the fellowships now?
Right. So when after finishing my urology, when I was, when I talk about subspecialty fellowships or going somewhere again for a training period, the first thing was, people used to get surprised. You are a super specialist. Why do you need something more? So that was the first question, which is quite relevant from the general public aspect. The other thing, the main factor about going for a fellowship was a family. When you are talking about fellowships and subspecialty practice, you are already 33, 34 or 35. You have a family, you may have a kid, you have a wife who may have a separate career, and you have a parents which are aging, they may have got retired. So these are the family aspect. I was lucky in that aspect that I had parents who were retired, so they were there to look after my kid. And my wife was working, she's also a doctor, so I had a financial backup. Even if I go for a fellowship, I have a limited source of income for a particular period of time, I have a financial backup. So these were the factors which were there to start with, and they are most important factor. So if you have this factor sorted out, you definitely are going to go through easily through these fellowships and subspecialty.
So very good, most important aspect. And so while doing fellowship, so what you feel the difference between urology as a general practice and you're now urology subspecialty, you're doing fellowship. So what some kind of change in a routine practice or you have observed?
So when I entered into urology, I thought that urology is a super specialty. You need a referrals and all. But when I completed my urology and when I went into a practice, this is a good aspect of our healthcare system, that now urology is a primary specialty. People understand that what are the disease or which are the sign symptoms for which you need to consult a urologist. So the difference between this, the subspecialty practices, we see more referral patient. We don't see primary patient with sign symptoms and then we evaluate them. We do diagnostic procedures and then we finally come to a diagnosis. Most of the patients are referred patient. Second, if you are in a subspecialty or one aspect of the practice, you see similar patient on your daily basis. You see long-term follow-up in oncology. You learn how do you diagnose recurrence in oncology? How do you treat those patients with recurrence in a long run? How do they behave? So these are the aspects which were little lacking when I was doing my urology training, and you are not mature enough at that point of time to understand this aspect. which you understand during this fellowship part.
Okay, so now you are into urology, uro-oncology subspecialty. Is there any fear of losing urology general practice? No, and how did you manage? I mean, you were doing the fellowship also at that time. No, people have that fear, no, losing urologist.
Yes,
as you guys
I
are.
do understand, and this was a concern. This is a concern, and this will be a concern. I feel there is definitely a fear of. It is not about losing the practice or something, but it is, as a being a urologist, you always love to do stone surgeries and prostate surgeries on your daily basis. So you don't do that.
And you get your comfort zone or day-to-day practice comfort level, and now you know switch to a particular things where.
So there is always a fear of losing your basic urology work, and but then I would say that this is going to happen in a long run. I mean, over a period of time, even if I do all urology work right now and then I decide to be a subspecialist or in one particular area, it is going to happen. So it is better to be early than late. You decide these things early in your career so that you have enough time to develop in that particular aspect. And yes, you have to overcome the fear. I mean, it is kind of a fear and risk both. So, but you have to overcome your fear.
So, if anyone wants to pursue such fellowship, what is your advice? When, how, and what he should pursue after a urology practice? What is his thought process, and what you advise?
Right. So first of all, I would like to congratulate to someone who is thinking about subspecialty fellowships after a super specialty, because then he has a lot of passion and interest for that, and probably a vision to develop something better in surgical field. Now the question is when, how, and all. So in that case, the simple answer is plan. So you should have your plans of doing these subspecialty fellowships or fellowships when you are in your second year of super specialty training. By that time, you would have known your interest and the exposure and training that you are getting. And so that is the first aspect, that you should have your interest by end of your second year of super specialty training. The next important aspect is you should have a good support. What I mean by support, that you should have good support from your parent institution. You should have recommendations from your faculties, your teachers at that particular institution, and you should take feedback from them. They would be the best person to guide you at that point of time. And I was also inspired and encouraged for the same while doing urology training. So planning is very important. Then second thing is getting into this fellowship is not purely on your qualification or purely on your parent institution. It is a lot about your attitude towards this fellowships, your dedication towards this fellowship, and how do people recognize this. This is being recognized by your presence in public. I mean, you should have a good networking skills. You should have some presentations in national or at least state level conferences, and then you should have few publications. So these are the things which will increase your chances to get a good fellowship position once you finish your urology training.
Okay. So what future practice aspect do you see in a urology subspecialty in India?
Right. So as we know that India is a huge country with a diverse population, diverse financial class, I mean the economical classes, and diverse facilities for training, as well as diverse facilities for a healthcare in a different region. So what I feel is subspecialty practice would be there in metro cities, entire one entire two cities. It would be difficult, at least in my career time, that it would be complete subspecialty practice. It is not going to be there. And even if I see a subspecialty practice, what I feel is there would be a subspecialty practice with basic urology practice. It is really difficult that complete subspecialty practice is possible, because we have limited opportunities. It is possible in institutions where there is no financial conflicts.
Yeah, and I think the hospitals and institutes in different tier 2 cities, they also need to be upgraded or need to be, start thinking about or creating such environment, having the subspecialty departments, then only I think it get digest among the fraternity also. So are we ready for the subspecialty practice in India? I mean, as a overall, as a medical fraternity, if we see not only about the urology, as a whole medical practice, what you see?
So regarding this, I would say that it is a natural phenomenon. Where we were before 20 years, we are not at the same place after 20 years. So as a natural progress of the medical fraternity or the healthcare facilities and all, it is going to happen. Like, if forget about urology, if you see surgical gastroenterology, then now there are three defined areas: colorectal surgeries, upper GI and pediatric surgeries, and hepatobiliary and pancreatic surgeries. So it is going to happen because you need that skill set. For that skill set or for that result, you need to focus on a narrow aspect, and then you can give a good result. So it is going to happen. Maybe it may take a different time period in different geographical location, but it is going to be there in next 1 decade, I guess.
So what challenges do you see in a medical field overall to go for subspecialty practice in India?
So, I mean, the challenges about this subspecialty practice is, I think, first is adequate training. Because let me give you a single example that when I was general surgery trainee, I had all surgical super specialty work to do. Now in the same department there are 4 times more residents or trainees, and all the super specialty work has been taken care by super specialists. So there is a dilution of training that is definitely there all over the India. One is that, so when you complete your specialty or super specialty, the training is not adequate. Sometimes I felt that. So first is, for such subspecialty practice, you should have adequate training options. You should have adequate standardized and with systemic fellowships available. The other thing is, there should be an adequate market for such subspecialty work, for which you need adequate opportunities in hospital setups or in your the area of where you want to settle down. So there should be adequate opportunities. And third thing is financial aspect. There should be a reasonable remuneration if you want to practice a particular aspect of your expertise. So these are the few challenges that I see, and this is gradually becoming gradually there are more opportunities, more fellowship or training options, and now there are reasonable remuneration options available, at least in metro cities, big tier 1, tier 2 cities.
So I think this is a very good conversation with you, your experience, your journey, and your advice to the upcoming urologist or urology graduates, and they want to plan subspecialty or as a urology, different subspecialties. We have already talked in our previous YouTube videos in urology subspecialties and how and what all are options, what all are fraternity, different things. I hope it will be helpful to our viewers, to the upcoming postgraduates, medical graduates who are looking for such future opportunities and all. So I think that's all for this conversation, and it's a very good talk with you, Dr. Raj, and wish you all the best for your Uro-Oncology subspecialty practice, as you have recently started your practice in your area of interest, and as you are at a very good place, the Zydus Cancer Hospital, Ahmedabad, a very good oncology setup under one roof with all these onco subspecialties will be for you. Wish you all the best. So that's all for this today's Docthub Talks. We hope that it will help you to decide in a subspecialty practice after urology training what to do and how to pursue all the different aspects we have already discussed in our previous videos. Also separately, we have covered dilemma in subspecialty practice. Also we have covered why fellowship after urology. That also video you can further watch, so you will get a more idea. Thank you very much for joining with us.